My name's Linda. I'm going to be your nurse today. I'm going to change your dressing. First of all, what I'd like to do is just take a look at your dressing that you have. Can you tell me your name and birthday? Okay, thank you. So all I'm going to do at this point is I'm going to take a look at his dressing. I'm going to go ahead and raise the bed so I don't have to bend over. Even though I'm short, it's still a long way down there. Try to keep your patient covered as much as possible so you're not exposing them. Okay. Then I'm going to apply some gloves because I don't really want to touch anything that I don't have to without my gloves on. All I'm going to do is loosen the tape from one side. And for the sake of the video, I'm going to show you guys what it looks like. So I'm going to look under here, and I see that he's got an ABD pad. There's a fluff on top. I have a drain sponge, and then underneath, and we can't touch this because it's there, underneath that is, looks like another 4x4. So all I'm doing is looking. I can't touch because it's sterile, and I have on clean gloves, not sterile gloves. Okay, Mr. Smith, it looks really good. I'm going to go get my supplies now so I can get this changed for you. Can you tell me if you're having any pain today? And can you also tell me if you're allergic to anything, any betadine, any kind of tape or anything like that? Okay, thank you. Always put your patient back down into the lowest position before you leave the room to go get your supplies. Make sure their call light's in reach. I'll be back in just a little bit. Okay, Mr. Smith, I'm back with all your stuff. We're going to go ahead and change your dressing. Are you still feeling okay?
Yes, sorry.
Okay, could you go ahead and tell me your name and birthday one more time? Okay, thank you. Okay, so what I have gathered for my supplies, I've gathered a blanket because when I expose him, I want to cover him up at the top so he's warm and comfortable and doesn't feel exposed. I've gathered some saline because I'm going to clean the wound, and this is a brand new bottle. Make sure that you check the expiration date on it to make sure that it's good. If it has been opened, you can use it up to 24 hours, so make sure if it has been opened that somebody has date and timed it. If not, throw it away and get a new bottle. So I've got my saline. I have a red bag to dispose of the old dressing. I have some gauze that are actually in a pack that I'm going to use for cleaning because I can pour my saline into this and use it for cleaning. I've got a pen, and I also have something to label my bottle of saline with because I got a brand new bottle. I've got tape to tape it down with. A couple of blue pads that we'll use as a barrier because this bedside table is not necessarily a clean surface. They eat on it, they sneeze on it, so we want to have a nice barrier to put. It's just clean, but we want to be able to put our sterile supplies on something clean. The other things I have are the dressings that go on the wound. So I got a couple of packs of 4x4s. I know he's going to need an ABD to cover it with. I know he had a drain sponge on. So with that, the other thing I'm going to need is a pair of sterile gloves in my size. Another thing you can do if you're grabbing them is you can stick an extra pair of sterile gloves in your pocket, which makes it really handy because if I contaminate myself in the room, I can simply take that out and change my gloves. So if you want an extra pair and you're not really sure of your skills, it's a good time to go ahead and stick a pair in there. Okay, Mr. Smith, let's go ahead and get started. Again, I'm going to go ahead and raise my bed to about my belly button. Put your rail down so you can reach him so you're not bending over anything. One of the things that you want to do with your sterile field is your sterile supplies have to be in a fashion to where you can see the wound and you can see your sterile field because you can never turn your back to it. If you ever turn your back to it, it's no longer sterile. So you have to get your table set up just like you want it before you get started. So I'm going to go ahead and raise my table just a little bit because another thing with sterile is you never drop your hands below your waist because if you do, they're considered non-sterile. So I need to be working at this level the whole time and have everything in my vision. Okay, so Mr. Smith, what I'm going to do is go ahead and take this old dressing off. I'm going to cover you up just to keep you warm. Let me know if you get too hot. Please keep your hands down to the sides for me and don't reach in. If you need to cough or sneeze, please do that to the side because I'm going to have your dressing open and I don't want you to cough or sneeze over your wound. And this doesn't have to be pretty, it's just to cover them up and make them more comfortable. Okay, so now I can either take off the dressing or I can set up my sterile field. I'm going to go ahead and take off my dressing first because he's laying still, he's not moving around a whole lot. If he was real agitated or something like that, I may go ahead and do this to keep him from contaminating the sterile field. So to keep him as covered as possible, but yet I need this far enough out of the way that I do not touch anything with my sterile gloves. So make sure you get you a nice open field here to work with the inside. Okay, now get my dressing off, and I typically tape my bag to my table. You can do this however you want, but this is a good way to do it so that way everything's right in front of you when you're doing it. So just a piece of tape to get this right here. Okay, so again, clean your hands before we start touching anything. I'm going to remove this dressing with a pair of clean gloves. If I can get them on. You have to let your hand sanitizer dry. Okay, and remember, this is all, I can touch the outside, but I can't touch the inside. So I'm going to loosen my tapes on all sides. I'm going to take it off in layers, and each layer I'm going to look at because I need to document. This is where I'm going to document what I see. So on this layer, I see a fairly good size, and I don't have a ruler with me, but I'm going to say about 5-inch in diameter field of serous sanguineous drainage. This all goes in your trash bag. And I'm going to just touch the top of these as I go. I'm not going to get into the wound because it's sterile. So here's my fluff that's on top of my Penrose drain, and it's completely saturated, and I would say that that's serous sanguineous as well. Then my next layer that I have is my drain sponge, and it looks like it has just a small amount of sanguineous drainage, and to describe that, I would say that's about maybe 1.5 to 2 inches this direction, so you're going to give it a direction. So like lengthwise it'll be 2 inches, and width is going to be about 1 inch on the drain sponge. So the next thing I have is the cover for the incision, which is my 4x4. So I'm going to bring it up, look at it, and on it I have maybe a $50. Remember, we could use $50, a $50 size of sanguineous drainage on that as well. So now my wound is open. Please don't touch anything because I'm going to be working on the field over here to the side. I can now take these clean gloves off because I don't need them anymore right now. I'm going to set up this field.